I remember one of my first visits to Burkina Faso, a small country in West Africa. We were supporting the local health facility and community in screening for cervical cancer, a disease that's 100% preventable and treatable. This is a cancer we know how to eradicate, and yet 266,000 women a year die from cervical cancer, the majority of whom live in countries like Burkina Faso, where they don't have access to the care they need. The day we visited the clinic, a crowd of women and children were there waiting for us. As we arrived, the women began singing to welcome me. A village chief who was there stepped forward and presented me with a chicken and a goat in appreciation for helping the women. Midwives from surrounding communities whom we had trained in cervical cancer prevention screening were there to support us. But it's the women I won't forget. More than 200 women came that day, carrying babies on their backs, many of them having walked hours for the chance to be screened for the first time in their lives. The line seemed to go on forever. Mothers and aunts, sisters and daughters who just wanted to know if they were healthy. That's one of the core tenets of Jhpiego, ensuring that everyone has access to quality health care. Because where a woman, where a man, where a family lives shouldn't determine if they live, if they thrive, if they succeed. I believe that.
That commitment to equity in healthcare, regardless of gender, income, or class, is what drives Leslie Mancuso as the president and CEO of Jhpiego, a global health nonprofit and Johns Hopkins University affiliate. Jhpiego has worked in 155 countries over 50 years to save lives, improve health, and transform futures. Growing up in Connecticut as one of 4 children, Leslie learned from her parents the importance of serving your community, of living up to your full potential, and of working together to ensure opportunities for all. Early in her career as a pediatric intensive care nurse, she saw the power of high-quality healthcare in saving lives. She also soon realized the opportunity a career in public health could afford a dedicated, talented leader and strategic thinker who saw the potential in ensuring evidence-based care reached those who need it most and innovating new ways to accelerate impact. The value she places on equitable access to high-quality healthcare and her deep experience as a nurse first, CEO second, inform her leadership of Jhpiego and the culture of respect and inclusion she's instilled at the Baltimore headquartered organization. Of her nearly 4,000 staff worldwide, 92% work in the countries where they live. As Leslie often explains, the work of Jhpiego begins and ends with the people they serve. Jhpiego's experienced global health professionals across the world work alongside families, communities, and countries to make their goals a reality, to bring real solutions and lasting change, ensuring access to transformative health services that put women, men, and families at the center of care. For 5 decades, Jhpiego has brought its expertise to bear to help countries become self-reliant, to determine and lead the way toward their own bright futures. From Burkina Faso to Baltimore, alongside Dr. Mancuso's vision and leadership, families can take hold of their dreams and make them a reality.